It's me again, Loretta. A little update. I've been having a lot of problems with my right ovary and tube, and it's making my periods abnormal, and so the doctor wants to do an HSG on me in about a week, and that's kind of like doing a DNC and all that, but it's a little bit different. The HSG is an X-ray study of the uterus and the fallopian tubes. The procedure involves the introduction of radio peak dye into the uterus through a special instrument. X-ray pictures are then taken as the dye passes through the uterus through a special instrument. X-ray pictures are then taken, and when the dye passes from the uterus and out of the ends of the tube, the test helps to determine that the tubes are open and that the uterus is a normal shape. During procedure, I may experience some mild cramping, which that's nothing unusual because I cramp all the time. During the procedure, I may, like I said, experience some mild cramping. I may also have cramping along with light bleeding for a day or so after the procedure. These symptoms are to be expected. It should not be cause for any alarm. She did mention to take ibuprofen or leave unless allergic before and after the procedure. These may be purchased over the counter. May return to work the same day if I desire. I can over the counter purchase those, which I already have a prescription for the ibuprofen from the doctor. I have 800 milligrams and 600 milligrams, so that helps me a lot. I've been taking those though for the cramps. They help a lot better than any really pain killers. The painkillers that you really need are only if you are in severe pain, and I take tramadol, but that's only if I'm severely hurting and I need it. I have to take the ibuprofen or leave, and I may return to work the same day if I desire, or if I want a day off, I just ask for it. They prescribed an antibiotic to prevent any type of infection. The prescription will be given to you. It is normal to experience acute abdominal pain, heavy bleeding, or fever. If you should develop these symptoms, you should contact the office as soon as possible. The procedure is generally performed between the 4th and 12th days of your menstrual cycle. To schedule, you have to schedule with the scheduling department as soon as your period starts. That the x-ray can be scheduled with the Department of Radiology. If my period starts over the weekend, I call them that Monday. If my period starts Monday through Friday, I call on my very first day of my period. The procedure is safe, however, complications can occur. This is very rare. Possible complications could include infection, bleeding, urine perforation, allergic reactions to medication. Please call the nurse immediately if you have any of the following symptoms during the week following your procedure. If you have a temperature of 100 degrees Fahrenheit, or excessive vaginal bleeding, minimal spotting, that's normal. Like if you have foul smelling vaginal discharge, severe pelvic pain, nausea, vomiting, or rash or itching. Instructions to prepare me for my HSG is just to purchase that Advil, Aleve, or Motrin of any brand of ibuprofen, which I said I already have, over the counter, and take according to the instructions on the bottle. 30 minutes to 1 hour prior to the HSG they want me to take, because this is going to really cause me to cramp a lot. And my antibiotic the morning of the HSG, that is my prescription for doxycycline. It's an antibiotic, and I have 4 tablets that I have to take. And it's just Complete your antibiotics according to the instructions on your prescription. Make sure you take antibiotic with food. Arrive 45 minutes at least prior to your appointment, or an hour for your HSG. In outpatient registration on the first floor of the ambulatory care center. Do not empty your bladder. You have to have a full bladder prior to your HSG, as a semi-full bladder may aid in the ease of the test. They would rather you have a full bladder. That way when they go in there, and it makes it look like your uterus is lying, and then they can see that line, and then they can see below where the bladder is and all that. And they're telling me to discontinue glucophage. If you take glucophage 48 hours prior to the HSG, if you don't experience any problems, you may resume your glucophage. I don't take glucophage, so I don't worry about that. They gave me the prescription for the doxycycline 100 milligram, dispensed 4 tablets. I have to do this on May the 20th for my HSD. They gave me some information on abnormal bleeding, dilation, and curettage. They also gave me another one on the hysteroscopy. I think that's how you say it. Hysteroscopy. Anyway, like I said, I have to go for this appointment, and they're going to do this HSG, and as soon as they do the HSG, they have scheduled surgery for June the 20th. She believes that if they take my right tube and my right ovary off, that will aid in some of the pain that I've been having. They are going to go in there and they're going to open the left tube to see if maybe I can conceive. And after doing that so many months, then if it's not seeming to work to them, they will, in other words, we're going to do the egg donation, retrieval. In other words, we will use a donor's eggs if this does not work. Don't think that it's all going to get in one day. Even if you have all the money to do this, it's not that easy. It's very stressing, because when we first started doing this, you know, I kept thinking, oh, I'm going to go in, I'm going to get pregnant right off. But there's so much more to it, and you really, really have got to be wanting a child, a baby, to actually go through all of this. And she told me that if I was going to go through all this, this was my first choice. And I only have 2 choices. I can either get my tube untied and hope that I get pregnant, or I can do the egg donor. And that's the only 2 options that I have. I don't have any more options. I'm 47 years old. I'm almost about to go through the change, and they're trying to help me here. And she knows I really, really want a baby, and I would really rather use my eggs. But you know, if all else fails and we can't use our own eggs, and we will go with the egg donor. But please don't let this just make you feel like you're disappointed, because it's not disappointing me. It's just, it takes time for all this to happen. And yes, you have to go in every month while you're on your period. First day you call, you got to tell them that that's your first day of your period, because they do the transvaginals and blood work and all that when the woman is menstruating. So don't just think that it's going to happen in 1 or 2 months. It could take up to 6 months. It could take up to 8. It could take up to 12. Right now, when we started, was about 2 months ago, I'm going to say, in April. This is May. And now I'm just now finding out that I need to go ahead and have the surgery. and if it's possible to take that right tube off, if it's possible to take that right ovary off, and they're going to look for everything. And then they're going to put me back on the pill. They have me on vitamin D, drink a lot of water, whatever, Gatorade, anything that puts back those essentials back into you, because you're going to lose a lot of fluid. And just have insurance, because if you have insurance, most of your insurance will pay for this. And when you have insurance, it's so much cheaper. You just would not believe how much cheaper it is. I think we've only spent less than $1,000 in a month's time, but I've gotten further a lot quicker. And even though I feel like it's taking its time and it's just dragging, I have to do it. This is something that I strongly believe in, and if you believe in it too, you do everything in your sight and your possibility to get that child here. And I'm hoping it's through the natural way, and I'm really excited about the surgery, and I'm praying that I will be able to use my eggs, and we will be able to get pregnant naturally. If not, by October of this year, I will probably go with an egg donor, and if all else fails, the egg donor's my last try. I'm not giving up. I just have two choices. I can either have this done and have that tube open and try to conceive, or I can use an egg donor. That's the only two possible chances that I have. But anyway, I wanted to share that with y'all. And May the 20th, today is the 13th of May, May the 20th, I will get back with y'all. I'm going to let you know a little bit more about what's going on. And don't get, frustrated or aggravated. Just know that God and that doctor and those nurses are working with you to do everything that they possibly can to achieve a live birth. Just keep praying, and I will get back to y'all and let y'all know further. Thank you.